Erev Tov, good evening, everyone. Thank you to all of you for joining us tonight. We know that tonight we are commemorating Yom HaShoah tonight and tomorrow. We know that there's a program at 7:30 and another program at 8:30. And so we want to respect that, and we'll finish in a timely fashion, and want to express gratitude to all of you for making the time to be here. First, I want to welcome everyone, our broader community, back to school after Pesach. It was really a joy to be able to see faculty and students together today again in school. I think it's just uplifting to be able to get us back together and learning the way that things should be, even though it is, of course, different than the norm. I also hope that everyone on the call was able to enjoy a meaningful Pesach, although clearly a very different one than the norm. I hope that it was restorative in its own unique way. Our agenda this evening, we have two things on the agenda. A little bit later on, we will hear from our resident expert, Dr. Rocker, who has been such an amazing resource for us. Rabbi Krauss will speak first and then introduce Dr. Rocker. But first, before that, we have with us, I should say just a sentence before, that it's a blessing for all of us to have a board of trustees that exhibits amazing support for faculty and community and students in every which way. And we are blessed to have Mr. Jack Bentheim as the president and leader of that board of trustees. He's here with us to discuss some financial matters that are of importance to us as a community. So it is my pleasure to introduce Jack Bentheim. Jack, thanks for being here.
Thank you. Everyone hears me?
Yeah.
Perfect. So thank you all for, and everyone for doing this. These town hall meetings have been very, very informative. And my own personal thanks to Dr. Raka for all he's doing to keep the community up to date and comfortable in the knowledge that people are doing what he's doing and taking care of us and the community at large. We just got over Pesach. Seder was strange for myself. I think the first time both of us were ever alone for a Seder in our whole lives. And part of the complications, everyone had their own, was hiding the aftercoma and then trying to remember where we'd hit it. But we got through that. And obviously presence this year was a lot easier because it was just the two of us. So financially, the school is so far doing okay. I mean, most tuitions have been paid. Most of the budgets have been in. And even though obviously from what we've communicated to the community, we have seen an increase in either deferrals or requests for scholarships. These are numbers that we are basically able to handle through the year, which for us ends in a month. The problems we're facing going forward, there's problems everyone's facing, is this coming school year. Registrations, I think, will go out this week, or if not this week, then next week. And I went in, sort of the good news is, we've been getting a lot of requests because of the great job the principals and teachers have been doing. We're getting a lot of requests. People want to come to SAR next year. But on the other hand, our concern obviously is for the parents and the kids who are in the school. To that end, with the registration going out next week, I want to announce that notwithstanding we've all heard about that we were intending to raise tuitions by 2% to cover the salary increases. The board has decided to rescind that increase. So when the tuitions go out, the letter will go out, you'll see that we have rescinded that increase. Besides that, recognizing the hardship that many of our parents are suffering with, we are in negotiations with various providers of services that we have not consumed yet and won't be consumed. Negotiating with them, have we given them money in advance, or we have contracts, and whatever we get back will be returned prorately to the parent body. But what are challenges we're facing, and one of the ways we're going to cover it. So the challenges first are we are expecting to see an increase in scholarship requests, an increase in deferrals, and a decrease in fundraising. Basically, the school gives out $7 million a year in scholarship money. And based on what we've seen these last few months, we feel that is easily going to rise to 10 million, if not above that. And we raise about $3.5 million a year, and we anticipate that number to drop. That's the bad news. The good news is we applied on time, and really kudos to Deborah and Pearl and to the staff. We got our loan application in on time for what's known as a PPE, and we were granted, and we have received about $5.5 million from the federal government, initially as a loan, and if we keep the salaries at a certain level, it will turn into a grant. So that's really great news, because that will allow us to continue planning for next year, because there will be a next year. I mean, this thing will plateau, it will start going down, and we need to make sure that we keep and we properly incentivize and pay our teachers and our staff and our principals, so the school could be what it always was and what it has been through this crisis. So that's where we are. We are, as I said, just to repeat, we're going to rescind the increase. Registrations are going out, and as what we said all along, we never budget for scholarships. So if anyone feels that they need scholarships, they never asked before, they need to defer, you have Deborah's number, please contact her, and we will do the best we can. So that's what we're up to. Thank you all for sending your kids to this school. It's sort of our responsibility, which we take very seriously, to do the best we can to provide your kids with the best in Jewish education. And this will be behind us. And we'll go back looking at this thing next Pesach, and hopefully with a big smile on our face. So thank you for listening in.
Okay. Thank you. Thank you, Jack. And I just want to echo what Rabbi Hartstark opened up with, which is, I've been blessed to be working here working at SAR for 15 years. Rabbi Hartstark's got a couple of years on me on that. And Rabbi Kroll is trying to catch up in his second tour of duty. But we are blessed with not only the most amazing faculty in the world, but the most amazing lay leadership in the world, people who understand how you can combine excellence and kindness at the same time. And that is something that we've seen through what you've just heard, through the kinds of decisions that are being made, the way those decisions are being made, and the understanding that the answer always needs to be yes in terms of taking care of the people in our community. And I feel very blessed to be part of that kind of community. Not only, by the way, saying yes in terms of these things, but in terms of the incredible response that there was, really without much solicitation, when we were talking about supporting people outside of school, outside of the school needs and scholarship needs, but just to be able to take care of Pesach and daily needs, and to be able to respond to anybody in our community. That's a tribute to everybody out there, and that's a tribute to the unique community that we are. As Jack said, some of the details still need to be worked out. So we're going to ask for your patience in terms of that, in terms of figuring out what these numbers are, and kind of balancing the negotiations in a way that's both strategically appropriate and kind of morally appropriate in terms of commitments that we've made, but also knowing that we're that things are tight for everyone, and we need to really be responsive and responsible to that. So I think that our ability to be able to do all of those things together is what makes this school unique. I had the opportunity to speak to our faculty last night, just a little bit of attempt at a little bit of chizuk, a little bit of strength before we go into what's at least 4 weeks and likely more of unusual learning, but important learning nonetheless. And I talked about the concept of ein simcha k'hatarat hasfekot, that one of the greatest avenues of joy is clarity. When we know what's coming, when we know how the light at the end of the tunnel and when it's going to show up and how it's going to show up. And the converse of that is that when there is no clarity, that creates a lot of anxiety. So we certainly know that from the kids to the teachers to the parents to the lay leadership, there's a lot of anxiety, but at the same time, there's a lot of positivity. And as I also quoted our the second principal of SAR, who was my principal, Rabbi Fold, used to always say, we read it on the seventh day of Pesach, Daber el b'nei Yisrael v'yisau. Kind of, we don't really have a choice. We just got to keep on going. There's a sea in front of us. There are Egyptians behind us, and we really have to just keep on moving because that's the only thing that we can do. And that's kind of what we're trying to do. We're hoping, we're praying, we're looking for different kinds of Hatarat HaSfekot, for different ways of reaching that clarity and getting to a place where June, hopefully September, will be normal, or certainly a lot closer to normal. But having the community behind us is really what allows us to give each other strength and hopefully pass that strength on to our children, to our students, through our faculty. So Jack, thank you for that. And to all of you, thank you for being part of that unique community. And if there are questions, we're going to send this out in communications, as Jack said, this week, and with registration at the end of the week or early next week. And certainly happy to take your questions, but we're trying to be as transparent as we can with the information that we have. Dr. Rocker, we miss you. It's been a couple of weeks. We're hoping that you could provide some clarity. I spoke to you earlier and you kind of told me that you might disappoint, but you've always been very honest with us, and we deeply, deeply appreciate that. So, what I asked you to do earlier was to give us a little bit of update from what you're seeing in the hospital, or hospitals or areas that you're working with, to tell us a little bit, if you can, about what all these testing conversations mean, a little bit about how maybe do you have any, not exactly a crystal ball, but can you look 3 months out and describe what hopefully that will look like for us and for the world? And I guess that's a tall order, so you can start with that, and we'll take it from there. Thank you, Josh.
Thank you very much, Rabbi Krause. And thank you to the administration, to the trustees, and I want to thank also the medical team that has been doing a rock solid job, and to all the teachers who I know are struggling with their own kids at home while teaching. So thank you guys very much as well. So to start off with state of affairs, and to just sort of reflect a little bit on what you said, Rabbi Krause, having clarity and knowing where you're going is truly important, and truly affects morale. And I think in previous talks, we did not know where the peak was, when the peak was going to happen, or how high the peak was going to get. And we are now post-peak, by days. So the hospitals, and what I mean by that is that we had a rapid rise early, and that continued for a long time. The ERs were very, very busy. The hospitals were full. And what we are seeing now, and has been consistent over the last week plus, is that the emergency departments are seeing fewer patients than they usually do in a non-COVID year. So what used to be extremely busy emergency departments are now much more relaxed. However, that doesn't mean that the hospital is still relaxed. I can tell you at LIJ, the hospital that I'm associated with, I'm pediatrics, but LIJ is the adult side. They have created 9 additional units to handle all the COVID patients that have come in. Just the number of COVID patients were more than the sheer capacity that the hospital had. So we were opening up spaces everywhere. We have already closed 3 units. So that is a great, great sign. However, we still have an extraordinary number of ICU patients. We still have an extraordinary number of intubated patients. So we are not out of the woods at all, but there is some clarity, and there is some hope that the peak is behind us. And that was what we were concerned about. The whole concern, the whole thought behind social distancing was that we will save the hospitals, and we'll save the burden on the healthcare system. And we definitely did do a good job at that. And I thank everyone tremendously for all the work that they have done in their quiet ways, which is staying inside and practicing social distancing. So the only way that we were able to get where we are is because of people's practice. And if we abandon those practices, then we will, hit new peaks. And so the second thing that people want to know about is, when can we get back together? When can we stop the social distancing? And the answer is not yet, not for a while. But what I can tell you is people are definitely acting a little bit more casually. I could say for all the essential workers, we've been driving to work with no traffic whatsoever for the last month and a half, and I could tell you the last several days, there are many, many more people on the road. And so people are treating it as if things are, it's a new reality. And that is not true. Yes, we hit a peak, but COVID is still there. If you get it and you are sick, it is still a concerning illness. And you still have to do the best that you can to protect yourself from being exposed and to minimize the spread throughout the community. So social distancing, again, I have to reiterate, we have to practice it. The governor now is asking that we all wear masks when we're out on the street. And that is still something that is important as well. In regards to antibody testing, so there are a lot of different antibody tests out there, some that are FDA approved, some that are not FDA approved. And they are going to be doing them more and more. The question is how much information can we glean from them? And that is, it's not like you get an antibody test and we know 100% that it means that you have immunity. We are not 100% sure of that yet. The more that we do, the more we will understand. And I could tell you the hospitals that I'm associated with, or the institutions, Northwell, are going to be doing a tremendous amount of reaching out to their healthcare workers who have been exposed, and they're going to be churning out tests and then trying to interpret them so that we know, because there are many different tests and they're looking at different antibodies, we will know which one potentially is protective and which one is not. We do not have that full information yet. So yes, it is important to get tested. If you have the opportunity, get tested, volunteer to get tested, because that is going to help research so that we can understand how to handle things in the future. But if you are positive, what that means is you certainly had it, but we don't exactly know how to interpret that just yet. Then that leads to the next point, which is convalescent serum. So convalescent means that you've been exposed, you had it, and you have antibody. There are tests being done on patients currently with convalescent serum, and we don't know if it works or not. So there are many research studies that are going on now, and research is slow and methodical. And even though the need for more information is significant right now, it doesn't mean that you can be slouched with your research methodology. We still have to follow things. And so that's why we don't know of many of the studies that are out, what is the most effective therapy right now for those who have COVID. A lot of people have probably heard about remdesivir, which is an antiviral medication. There was some recent data that showed that it was effective. However, we have to do a lot more studies to see the effectiveness of the medication. It was a small study, it wasn't completely well controlled, and so we really need to have randomized controlled studies to see how things work. Another thing I want to talk about is a transition that has occurred in regards to the way healthcare is sort of utilized and managed, because we recognize that people aren't going to doctor's appointments, aren't necessarily going to the emergency department, and are kind of scared to go to the hospital. So telemedicine has really taken off. And if that's a platform that people have access to utilize, please, if you have concerns, contact your doctors, use telemedicine. And they're also initiating home care. So they're giving people pulse oximeters at home that measures your oxygen by putting a little device on your finger. And also people are getting oxygen for their home. So a number of people are stable with low amounts of oxygen at home, but we then want them to be in communication with their doctors if their oxygen levels are low, despite giving themselves oxygen, because then maybe being in the hospital is the best place. Now, one thing that we have also seen is people, because of their fear of going to the hospital, are simply not going. And because of that, people are suffering at home when they could be in an environment that could help them. So one, if you find yourself in that situation, certainly contact doctors. And two, and this is important, if you know of people who are vulnerable and may be isolated, please reach out to them to see if there's anything that you could do, and just check up on them. Unfortunately, people, again, are suffering at home and even dying at home in isolation. And so we really need, as a community, to take care of them. I think that's a lot of the points that I want to address. In regards to what's the summer look like, when are we going to be more free? I think what we need to see is we hit the peak. We know that during Easter and Passover, people weren't as thoughtful about their social distancing. So we need to see what's going to happen in the next week or two and the consequences for that. And we also know that social distancing, as I mentioned, a lot more people are on the roads. We have to take each week or each 2 weeks at a time and reinterpret and recalibrate things. We know that there is significant financial consequences for the management that we are doing. That is to save people's lives and to create a safer environment for the hospital. However, it also has collateral consequences for everyone else. So these decisions are being made by individuals in government who are looking at both spectrums. They're looking at the medical consequences and then looking at the sort of psychological and financial consequences for the community. But I do not think we're making any changes for at least 2-3 weeks.
I want to thank you very much, Dr. Rocker, for your Dr. Rocker for your wisdom and for spending so much time on the, in addition to all of your work in the ER and in the hospital, to really taking care of us as well. I want to close out with Tehillim. We usually start with Tehillim, but we'll close out with a parak of Tehillim right now. And I also want to just remind everybody in the community that as Yom HaShoah begins tonight, there are commemorations in both the academy and the high school tomorrow. We send information out in an email. If people want to access that, you can access in the high school through a YouTube link and through a Zoom link in the academy. The academy program is at 9:30 tomorrow morning, and the high school program is at 10 a.m. Tomorrow morning. So please feel free to join us if you can. Please join me for a parak of Tehillim, and we will end with that. Shir Malot v'mamakim karaticha Adonai. Adonai shima v'koli tienos necha kashuvot l'kol tachanunai im avonot tishmor ya Adonai mi yamod ki imcha selicha leman tivarei kiviti Adonai kivta nafshi v'lid varo hochalti nafshi l'Adonai mishomrim laboker shomerim laboker Yachel Yisrael al Adonai Ki im Adonai chesed v'harbe imo fidut v'hu yiftet Yisrael mikol avonotav. Wish refuah shlema to all those who were affected, and may we all see each other in person speedily. Have a good evening, everybody.